Hi there, Todd Cameron here, general practitioner in Melbourne, Victoria. This is a message for Greg Hunt, our Health Minister, and Scott Morrison, our Prime Minister. Firstly, thank you for the work you did in creating these new item numbers. I believe it will go a long way to helping out, but I just want to talk to you a little bit about how it probably hasn't gone quite far enough and explain the rationale of why that is. You may know this from what we've posted earlier. I'm not sure how much of the work that I'm doing you're receiving. We decided last Friday that we would pivot our clinic to be from 100% face-to-face to 100% remote consulting in 4 days. And so today, Friday, is the last day that we will see patients in our clinic. We are still operating a screening process at the front door, which is an admin and a nurse personnel that are basically asking questions around mild and moderate and vague illness. Now, we both know, I'm not going to talk through the stats on this disease, but we both know that it is an artificial screening in that there's a large number of people that either have very mild or no symptoms at all that will in time be coming through there. So I'm very nervous about the prospect of gathering lots of people in our clinics. And I am very nervous about very well vectors coming in and spreading it amongst our community and increasing the burden on our hospital system. My focus in this video is purely about how we are able to keep our frontline workforce safe. That's my base layer in primary care. If we can keep them safe, then we can work on resource allocation. And if we can get the resource allocation right, we're going to need to do some innovation. You've played that part in the first salvo with these new item numbers, and Thrive is going to be a relative thing, but we've seen from the evidence of countries overseas that some do this really well, and the outcome is markedly better for the community. Others have done it very poorly, and we won't go too far down that path because you can easily determine what that is. So I'm going to talk to you about the problems that you're going to start seeing with the current restrictions on the item numbers. So the first thing is that the MBS and Medicare have carefully cultivated a culture of fear amongst GPs with compliance with Medicare numbers. That's been quite a reasonable approach in the past because we're talking big numbers, and so even 0.5% or 1% of people that are non-compliant or fraudulent is a big number, $300-400 million. I think that what you need to be doing though is sending a message about simplifying. We need people to move really fast, and my mission is to get every clinic in Australia that's a general practitioner clinic to pivot to full remote services. We've seen this done overseas. We're doing it in 4 days, but we've got a really talented group of people. We had 3 clinics on Tuesday, the first day back after the long weekend. We shut 1 clinic, so we've got a backup clinic that can be converted into a fever clinic if it's needed by the community. We aggregated all of our resources. We're in-house, we are using social distancing measures, and people will be whipped with the corona stick if they continue to breach those measures. Our doctors and our staff and our patients are now safe, but I'm not comfortable letting patients in this waiting room. And I know of clinics that are continuing to gather large numbers of patients in their waiting rooms. And the current item numbers, because they're restrictive, will cause most GPs to operate business as usual, and the least prepared clinic in the area will concentrate all of the patients that are unwell, and you will just make that a hotspot for COVID-19. So please allow people to use these numbers for all patients and discourage patients from entering the clinic, push them all to remote care. I think it's great that you've got some video stuff in there, but please, everybody, just move to telephones. With speed, we don't need complexity. These systems are not meant for wide-scale use at this point in time. Just get the phone layer right. In 2 to 4 weeks, maybe it's 2 months. If we find that we need video, which we will in some cases, then we can use the technology that already exists. But otherwise, you're just going to include 5 or 10 minutes of technology in every consult. Everybody knows how to use a phone. Not everybody has a phone, but certainly more people have a phone than have the ability to teleconferencing. So let's focus on the phones. The reason why you need to broaden it is really clear. You're already seeing this, but you're going to have a variety of people in our team, admin, nurse, GP, are all going to have more than one period of 14 days of quarantine over the period of this pandemic. And of course, you only have one period of isolation when you actually get COVID-19. But we're going to need to be able to run the team virtually through sequential periods of 14-day quarantines for all of these members. If people continue to come into the clinic, then it is likely that you'll get a synchronous infection in the clinic. That means all of the people are sick at the same time, and that clinic will probably never recover because nobody can go in and restart it. Our model is that we know that people are most likely going to get infected at home. More than 2/3 of cases currently have been infected through the home, but we are isolating people internally so they have their own rooms, and we have distance measures in the clinic, and we use good personal hygiene. So our goal is that if any infection is there, it's asynchronous, so the team can continue to function and serve our community. We've worked with our pharmacist, and we've put in place a strategy whereby the pharmacy will run without patients walking into the pharmacy. I don't know what's being done for pharmacists, but from talking to them, it doesn't sound like anything is being done. We've built a model that we're happy is safe for our pharmacist, it's safe for our team, and I do think we need to be exploring very quickly getting people out, walking around pharmacies, touching all the staff, having poor distance control between the staff in the pharmacy. Again, you're going to need all of these services available to serve the community in the coming pandemic. So let's do our best to look after our pharmacy brothers and sisters, make sure our primary care services are intact. We're keeping our allied health team, the ones that want to work with us. There are some that have said that we're going too early and we're too extreme. I think to be blunt, one more day of seeing patients is making me somewhat anxious because I'm concerned that somebody may end up with a breach. We're starting to see things that you would expect, patients saying they're lying at triage and then upstairs declaring it. They want clearance certificates for COVID to say that they don't have it, things that are just not possible. So I want to see us start thinking about how we're going to get a simplified approach to this, try and remove all these descriptors that make people anxious about using them. Your intent is that people need to use them, so make it clear that that's the intent. Let's see if we can pivot all of Australia within 2 weeks to doing all phone consults. That's going to mean this will continue to function. Otherwise, you're going to see GP clinics dropping like flies. And it's best that we are the ones doing the right care for the patients that we know. We can keep them calm. We can actually make sure that people are getting the care that they need by liaising with our pharmacists to get out to them. And I'm going to ask for a couple more favours. The first thing is, could we please get our Prime Minister to stop saying Australia is not immune from this? Because I know that would have sounded smart in the past, but it's a really silly thing to say. The second thing I'm going to ask is that whenever you do any meetings, can you please make sure that you are separated by 1.5 metres or more? Do not huddle in close so it's a great screenshot. I want to see you all modelling the behaviours that we are asking the public to do, because this does not discriminate. You know this. You're starting to see high profile people that have actually just been careless. Follow the rules, you know what they are, you know what works. We need to get moving on this. 1.5 metres, personal hygiene measures. Make sure that you have appropriate cough etiquette and sneezing etiquette, and that you isolate if you feel unwell and you get tested in the event that you become more unwell. So we should have drive-through testing stations. GPs can refer patients there, and we'll be managing them in the community. We're here to help. We all want to work with you. If you can give us some clear communication about what you want done, I'm happy to work with you to get that message to the community. Good luck with things. You're going to need all hands on deck. Looking forward to working with you. Thanks for listening. I've been Todd Cameron. Bye.